This is a resolution recognizing October 8th, 2024 as a day of action for the San Luis Obispo County Master Plan for Aging. Whereas San Luis Obispo County is considered a desirable area to live and to retire. And whereas more than 25% of San Luis Obispo County adult residents are identified as older adults or adults living with a disability, which is higher than the state average. And whereas many family and community members are inadequately or unpaid caregivers for their loved ones. And whereas many San Luis Obispo County public agencies, nonprofit organizations, and businesses serve and support these community members. But San Luis Obispo County does not have a focused strategy for aligning their needs and concerns with existing services and supports or developing resources to meet future needs. And whereas California adopted a master plan for aging in 2020, as a blueprint to prepare the state for an aging population and lead the way on aging, disability, and equity, and has committed over $9.5 billion to fund MPA initiatives, including local agencies' development of plans tailored to their communities. And whereas the County of San Luis Obispo Department of Social Services applied for and received a grant to support the local effort of community providers and assist in the development of a local aging and disability action plan, now titled the San Luis Obispo County Master Plan for Aging, SLOW MPA. Whereas the San Luis Obispo County Master Plan for Aging is being directly supported by the San Luis Obispo County Libraries, Public Health, Healthy Aging Services, Adult Services Policy Council, and various nonprofit providers, advocates, and community members. This collective is known as the San Luis Obispo County Master Plan on Aging Advisory Committee. And whereas the collective has engaged the community with the professional support of the consulting firm Health Management Associates to gather information with an intentional focus on our older adults, adults living with disabilities, their families and caregivers throughout San Luis Obispo County. And whereas recognizing the commitment of our community to complete the first iteration of the San Luis Obispo County Master Plan for Aging to identify and align community supports throughout San Luis Obispo County for older adults, people with disabilities, and caregivers. Now, therefore, be it resolved and ordered that the Board of Supervisors of the County of San Luis Obispo, State of California, does hereby recognize October 8, 2024 as a day of action for the SLOW County Master Plan for Aging to highlight the importance of creating a community where older adults, adults with disabilities, and caregivers can all live and age with dignity.
Thank you. I'd like to repeat my appreciation for the Board of Supervisors and the community and county staff for the support of this project. We hope it'll move the county as a whole forward to be a better place for all of us to live and age. Right.
Yeah, I'd just like to prepare just a quick short statement just for the folks that are hearing about this for the first time that will be tuning in, kind of learning about it. The California Master Plan on Aging was established January of 2021. And provides an intended blueprint for how the state of California intends to better prioritize the health and well-being of older Californians and those living with disabilities. With the California MPA came a call to the local governments, the private sector, and philanthropy to do the same. While San Luis Obispo County has a long history of collaborative work between public, private, and nonprofit entities who serve the needs of the previously mentioned community members, we know there is always more work to be done. The Department of Social Services is pleased to be one of only 3 counties selected in the first round of funding provided by the California Department of Aging to develop a local plan to support our community members living with disabilities and older residents while creating stronger supports for the needs of our future populations now. The San Luis Obispo Master Plan for Aging, or SLOW MPA for short, is a strategic community collaborative, and we hope it will be one of the larger stepping stones that contribute to the thriving community. The Department of Social Services is honored to partner with our longstanding and new community partners in the SLOW MPA Advisory Committee to ensure the initial plan provides our community with the strongest foundation for progress. Recognizing it is essential to have the voice of the community embedded in the plan, we use grant funding to hire consultants who provided us with online surveys and coordinated community-driven listening sessions to connect directly with older adults, those living with disabilities, their families, friends, and caregivers during community-driven listening sessions to collect both informal and narrative data. This effort has collected roughly around 800 surveys and will be used for the specific questions, data streams for the plan in its initial place. Additionally, to reinforce the SLOW MPA strategies and to ensure that they are accessible and reflect the needs of the community, the SLOW MPA Advisory Committee consists of several community advocates with lived experience and community perspectives, such as Linda here. Even in the early stages of the SLOW MPA, Committee engagements alone have created more intentional conversation and collaboration that has resulted in some very early stage efforts to improve crucial services that are needed in our county, such as supportive living and the development of more community day programs like that of Capslow's Adult Day Center in Paso. We hope for this momentum to continue and be reflected in the initial plan when it is released at the end of March 2025 and continues through its indefinite lifespan. Thank you.
Thank you. Supervisor Paulding, comments?
Thank you, Chair. Well, first, I want to thank everybody here that has been involved in the Master Plan on Aging process. It has truly been a collaborative effort between our nonprofit partners, community leaders, local government agencies. It's a model of a partnership, in my opinion. And I want to also thank two members in particular who I think stepped up to continue the leadership role within the advisory committee, and that's Linda Beck and Toria Linnea, who has since passed. Both of these wonderful women stepped up in so many ways to keep everything moving in that committee and to get through the process of hiring the consultant. And then, of course, to our county staff, Robert Diaz in Department of Social Services, I really appreciate you kind of leading this charge, and our public health department for leveraging other programs like healthy aging and having a presence within the committee. And, of course, to the consultant HMA. It's going to be really exciting when our board has a discussion around what the plan's recommendations are in March of next year and what we can do about it. So the categories of housing, healthcare, social connection, support for caregivers, all of those things have been identified as issues in our community health assessment. There's overlap with so many of our departments. We have this foundation for collaboration. It really is an exciting day of action here in SLO County. So again, thank you all for your participation. Let's keep this moving. And ultimately, I hope the board is able to adopt a plan that helps us move forward in some critical areas.
Supervisor Pichon?
I just want to thank you for all the hard work you're putting. 800 interviews is not an easy task. And so data-driven plan, looking forward to it coming next year. But again, thank you for taking the time to interview 800 people.
Supervisor Ortiz-Lake?
Yeah, thank you. Yeah, this is so important. I mean, I think the numbers, bear fact that we've got to be prepared, and that you're helping each other and all of the nonprofits that are out there. 25% is a significant part of our population, and so it's something that I really appreciate your efforts here. I also want to call out Supervisor Paulding, who's really made this a passion project to make sure that this continues to move forward. And so, thank you. As somebody who just got their Medicare, so thank you.
Supervisor Gibson?
Thank you, Madam Chair. I'm really excited at the energy that this organizing concept of the master plan, both at the state and the county level, brings to this. We've long had a lot of great individuals and a lot of individual organizations doing work in this county, and now to have a coherent organizing idea around it is really good. Having in recent years been through the last years of my parents and my mother-in-law, I see the need that we're addressing. That need's only going to grow as the demographic wave comes upon us. So I'm deeply grateful for your excitement and energy about this and look forward to that conversation when it comes to our board. Appreciate it.
And I, too, just want to thank you all for your dedication to the seniors in the county here and appreciate all the hard work. So thanks for being here and allowing us time to learn more and congratulate you on your efforts.